Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Cabergoline. Its brand name is Dostinex. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Cabergoline. We'll then touch on examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Cabergoline is a long-acting, selective dopamine receptor agonist. It has high affinity for D2 receptors and low affinity for D1, alpha 1 and 2, and serotonin receptors. It works by inhibiting the synthesis and release of prolactin from the anterior pituitary. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of hyperprolactinemia. With respect to contraindications or reasons we would not be able to prescribe Cabergoline, well, we just wouldn't give this medication, first of all, to a patient who had a hypersensitivity to ergot derivatives. We would also avoid giving this medication to patients who had uncontrolled hypertension or high blood pressure. If a patient had a history of pulmonary or pericardial fibrotic disorders, they would not use this medication. And finally, a patient would not use this medication if they had cardiac valvular disorders. Now for an example of dosing with Cabergoline. So in the treatment of hyperprolactinemia, we would see an initial dose typically of 0.25 milligrams orally twice weekly. The patient could then increase by 0.25 milligrams twice weekly at 4-week intervals, and the maximum dose would be 1 milligram twice weekly. If this medication was being used for another indication, such as lactation suppression, we may see 1 milligram orally given within 24 or at the 24 or 27 hour mark after delivery. As with all medications, there are some side effects or adverse reactions that patients may experience while using Cabergoline, so we'll go over some of those here now. Some common side effects may include nausea, which happens 28% of the time, constipation, which comes in at a percentage of 7 to 10, dizziness may happen to 9 to 17% of patients, and a headache may happen to 9 to 30% of patients. Fatigue comes in at 5 to 10%. More serious side effects may be congestive heart failure, disorder of the pericardium, heart valve disorders, or pulmonary fibrosis. Alright everybody, that's all we're going to talk about today with Cabergoline or Dostinex. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.